The upward bow pose, also named the wheel pose, is an advanced yoga pose that stretches and opens the body's entire anterior chain, in yellow, and simultaneously strengthens the elbow extensors, deltoid, gluteal muscles, and erector spinae, in red and pink. The upward bow pose is a challenging pose that can be attained with proper alignment. Just be careful not to push your body beyond its current level of flexibility and strength. See common problems.
1. Lie on your back, knees bent, feet parallel to the floor, heels close to pelvis. Flex your elbows so that the hands are placed beside the head with fingers facing the shoulders. Stage 2. Press your feet firmly against the floor. When exhaling, push the pelvis upward and raise the buttocks from the floor. Hands remain parallel. Stage 3. When exhaling, press feet and hands and push shoulders towards the back. Raise head while strengthening the elbows. Strengthening muscles are rectus femoris, iliopsoas, intercostal muscles, abdominal muscles, pectoralis major, sternocleidomastoid, longus colli, wrist flexors, and the latissimus dorsi. The main active muscles are gluteus maximus, deltoid, triceps brachii, and the quadriceps femoris. Physiological analysis. Knee joint extension. Hip joints hyperextension. Good extension ability in the hip joints depends on the hip flexor muscle group, which must be flexible enough to enable good range of hip extension. Spine, hyperextension of all the vertebrae. Shoulder joint, hyperflexion. Elbow joint, extension. Wrist joint, hyperextension.
The upward bow pose stretches the hip flexors. Iliacus, psoas major, rectus femoris, sartorius, tensor fasciae latae.
Anatomy trains. Upward bow pose is an advanced yoga pose that stretches the entire superficial front line. Here we can see also the stretching in the front functional line. Begins from the pectoralis major, passing along the abdominal aponeurosis down to the adductor longus. Another anatomical train that is stretched is the superficial front arm line, from the wrist flexors up to the pectoralis major. And here we see the deep front line, begins from the hip adductors, continues up on the psoas muscle and the associated fascia, and up till the neck flexors. Shortening the hip flexors will cause the following patterns. If one or more of the hip flexors is short, the pelvis will tend toward greater anterior tilt, increasing lumbar lordosis. This condition will cause high compression loads on the posterior part of the lower vertebrae. In other words, limitations in hip flexor extension will be expressed immediately in overextension in the lower back. Limitation in spinal extension. The upward bow position requires full spinal extension, but remember that the vertebrae in each area of the spine has a different anatomical structure. This structure dictates the movement options, and thus not every area can contribute equally to extension. The lumbar vertebrae, lower back, the main movement plane is sagittal and focuses on vertebral flexion and extension. The thoracic, upper back vertebrae have much less rear extension movement due to the structural dictates of the thoracic vertebrae, which do not allow this, but because of the anatomical structure of the vertebrae and because these vertebrae are connected to the rib cage. Limitation in ranges of shoulder joint movement. Rigidity and lack of shoulder flexion flexibility are very common in the population and often appear with thoracic rigidity as well, such as in cases of kyphosis. Limitations in the range of shoulder flexion have several possible causes: short muscles, joint problems, or a structural limitation. Tight muscles, tight pectoralis major, tight pectoralis minor, and tight latissimus dorsi. Limitation, pain, and overload on the wrist. Adaptation. Use a wall to preclude the need for strong wrist dorsiflexion. Preparatory exercises for improving wrist mobility and range. 1. Stretch the wrist dorsiflexion using the other hand in different directions and ranges. Sitting on hands and knees, place hands on the floor with fingers facing the body. Then lean back until you feel a gentle stretching of the anterior muscles of the forearm